Assalamualaikum warahmatullahi wabarakatuh. I beg to all the judges and fellow friends. My name is Hamizan. We'll be presenting our group Startup from Year 3. Our group is supervised by Dr. Alwani, binti Aziz. Let me start by saying a few words about our new inventions. As you can see on the screen, our invention is an application called PeriodonDx, which is created for aiding the diagnosis of periodontal disease. Before I proceed to the presentation, let me introduce to all of you my group members. We can break this following presentation into following subtopics: introduction, rationales and objective, new classification of periodontal disease diagnosis, solution and medium, advantages of PeriodonDx, target group, and also conclusion. The new classification is the product of the World Workshop on the classification of periodontal and peri-implant disease and conditions. It is held in Chicago in November 2017. The World Workshop was organized jointly by American Academy of Periodontology, AAP, and also European Federation of Periodontology, EFP, to create a consensus knowledge base for a new classification to be promoted globally. This new classification is totally different with previous classification, as it consists of staging and also grading, which is used in making periodontal diagnosis. The British Society of Periodontology, BSP, has developed a decision-making flowchart algorithm to assist practitioners to adapt to the current classification. This manual is very important for both general practitioner and periodontists to guide them in the decision-making process in order to obtain the right and accurate diagnosis for their patients. Why do we invent this app? Many general practitioners nowadays are not fully aware about the new periodontal classification, which includes staging and grading, and are not used to it. Hence, we will propose to develop an app to help and guide general practitioners or dental students using the simplified guidelines of BSP, which also incorporate the use of BPE as the first step before proceeding to staging and grading. The use of BPE in BSP guidelines will help clinicians to improve clinical diagnosis, since BPE is widely used screening tools to detect periodontal disease. First, to ease general practitioner or specialists in other disciplines to make a quick diagnosis for them to make appropriate periodontal referral. Second, to boost the confidence to general practitioner so that they will not have any hesitation to make a referral to periodontist regarding the periodontal diagnosis. So moving to the objective, we have three objectives. The first one, to act as a training tools for dental students and general practitioner in practicing to diagnose periodontal health status. Second, to assist dental students and general practitioner in making periodontal diagnosis and classification. Third, to encourage them in making periodontal referral without hesitation to make the correct diagnosis. As you can see, this is the new classification of periodontal disease 2017. Look at the diagram. This is the first step in BSP guidelines, whereby we have to know the BPE score of the patient. So let's revise what is BPE guidelines before we move to the apps. For the first step, the clinician must insert the BPE score of the patient. If the score is 0 or 1 or 2, the patient is most likely to have a healthy gingivitis case. Depending on the percentage of bleeding during probing, and based on that, the patient can be described as healthy, localized, or generalized gingivitis. If patient have BPE score of 3 or 4, appropriate radiographic assessment is required in order to confirm the diagnosis. For code 3, if it doesn't involve bone loss, it can go to the code 0 or 1 or 2 pathway. However, if it involves bone loss, it can go to code 4 pathway. And the patient could be diagnosed having periodontitis. The diagnosis is highly rely on the evidence of bone loss in the radiograph for the current classification. If the person does not show any bone loss, it should not be diagnosed as periodontitis. For extent of periodontitis, it depends on the affected percentage of tooth undergone bone loss, whether it can be a specific molar incisor pattern, localized or generalized periodontitis. Once we have diagnosed whether it is gingivitis or periodontitis, we will be moving to staging and grading if it is diagnosed as periodontitis. However, if it is gingivitis, we will be focusing on extent diagnosis, but will not further go into the staging and grading step. So, in this step, radiograph plays an important role to make diagnosis. If a person has a deep pocket on one sexton, then we have to take radiograph at the site of the deepest pocket of the teeth. We have to make sure that there is no other external factors that do not relate to periodontal loss, such as having impacted 3.8 that gives effect of having periodontal loss at 3.7, and must exclude this factor from using BSP guideline. And we will have to confirm the percentage of bone loss to have a good diagnosis by estimating the percentage of bone loss based on the classification. So we will be looking at the bone loss of the total length of the root, not the teeth. Next, for grading, we will divide the percentage of bone loss by age of the patient, and the result will be based on three classifications. First, less than 0.5, second, 0.5 to 1, and the third one is more than 1. We will then assess the current periodontal risk, which is divided into three: currently stable, currently in remission, and also currently unstable. The last one is stating the risk factor if the patient has any. Hence, we will get the complete diagnosis statement. The primary factor that elicited the idea to invent this application is since the introduction of 2017 classification system for diagnosis the periodontal disease, many practitioners, especially general practitioner and also practitioner across other disciplines than periodontology, find it difficult to diagnose periodontal disease due to the implementation of staging and grading and few other criteria that need to be considered before diagnosis can be done. To overcome that problem, we come up with a solution, which is PeriodonDx application. This application makes it very easy, straightforward, and also less time consuming for general practitioner and periodontists to acquire a periodontal diagnosis that meets the BSP guideline or recommendation. We utilize a medium called MobineCube to create this app. Without further ado, let's watch the demonstration video. Let's get started. First, select the BPE score, code 0, 1 or 2. For the next step, is insert the number of tooth present and also bleeding on probing score. We will get the diagnosis. Next, we'll select the BPE score, code 4. Insert the number of tooth present and tooth affected for bone loss or pocket depth. We'll get the diagnosis localized periodontitis. Clicking the info button will help to guide you in determining the bone loss percentage. Step 3, select interproximal bone loss. We'll get the staging. Step 4, grading. You can insert the percentage of bone loss and the age of patient. So we will get grade C. Current periodontitis status for step 5. Those readings are obtained from intraoral examination. And put the risk assessment. And we'll get the complete diagnosis. So this app have several advantages. This app is user-friendly, where the user can simply choose and click the options regarding to the patient's condition. It is also free and follow the latest recommended guidelines, which is completely adhere to the BSP guidelines flowchart. Besides that, this app is correctly formatted exactly as per the BSP guidelines. We solely created this app for general practitioner, periodontists, specialists from other disciplines, and also dental students to benefit from it. For conclusion, In order to facilitate and reduce the time normally consumed by general practitioners in making a periodontal diagnosis, we have created an application called PeriodonDx. So let's benefit from this app, which is easy to use and user friendly.